So I'm going to talk today about Data for Good, AI's impact on global health. And I'd like to start first with a brief introductory video that explains the work of Virtue Foundation in this area.
Healthcare remains a significant challenge around the world, with half the planet's population lacking access to adequate medical care. Yet the technology and resources are there. The US alone donates more than $250 million and thousands of physician hours annually to short-term medical missions. But significant inefficiencies exist, causing unnecessary suffering. We believe this is a solvable problem, and that we can learn from models like the world's financial markets, which utilize big data real-time to facilitate the flow of capital. What if we could leverage technology to better match needs and resources and reduce the inefficiencies in the delivery of healthcare? What if we could use big data to make the invisible visible and see where the need is greatest, and then deploy those resources where they'll do the most good? We believe this is possible. The Virtue Foundation Data Mapping Initiative is a new tool that pulls data from myriad sources such as social media, detecting patterns through natural language processing, satellite mapping providing geospatial data on infrastructure, including roads and building heights, and then uses machine learning algorithms to deliver predictive analytics that match volunteers with the places, the projects, the patients that have the most need and can most benefit from their skills. Volunteers can use this technology to search for their specialty and indicate their preferences, and then learn where they will have the most impact. The result? Countless data points analyzed, thousands of doctors deployed, millions of lives impacted.
Thank you so much. I'm particularly proud of that video because the footage is of Virtue Foundation teams on the ground delivering much needed care in low and middle income countries. And at the end of that video, you see my colleague, Dr. Ebi Elahi, who is a oculoplastic surgeon and a professor of global health at Mount Sinai, and really had the vision on the ground on these medical missions to say, you know, here we are traveling all this distance, and there are so many others like us trying to deliver care to people in need and to increase the knowledge capability of the physicians and healthcare professionals on the ground. But this is a lemon market. There's a asymmetry of information. Those that most need our care are least able to declare themselves. And those that are able to deliver that care, the physicians and surgeons with specialty and subspecialty capabilities, there's so many frictions to get involved. So wouldn't it be great if we could use AI? And bear in mind, he had this thought in 2009, 2010, to make the invisible visible and have the granular on-the-ground data from low and middle income countries so that we could match the clinical providers to where they could best deliver care. And it is very much a market dynamics problem, like financial markets. And in addition to clinicians being interested in this data, governments are also interested in this data in low and middle income countries because they don't have the capability from an AI perspective. So this is data that is needed both for this flow of clinicians, but also for on-the-ground decision-making and insights into how we can have impact. There is over 143 million people every year in low and middle income countries who are not getting the surgeries that they need. That's every single year. And it's this big idea of having more granular information to be able to directly target the right intervention to the right location that we are talking about. So what do? We're an NGO. We have special consultative status to the United Nations. We've been delivering medical missions on the ground for decades. We thought, well, there must be a central repository of this somewhere, right? There isn't. And then we realized it's actually really difficult. It's a challenging problem. And it could only happen at this moment in time where big data, AI, machine learning is possible. So the first thing we did was build this foundational data set of all the healthcare facilities and healthcare NGOs in low and middle income countries. But it wasn't just the data set of these facilities. It's all the data that's associated with them. How many ORs do they have? What specialties can they do? And do they have a blood bank? Is there advanced imaging? These are the things you need to know as a physician before you go to a location in terms of being able to help a specific patient with a specific problem. So we created this foundational data set. We published it with Taylor and Francis, the first edition in 2020, the second in 2021, and launched it on a web-based platform to be able to have access to this information at scale. We then took this data and layered it with other data that is available freely. Nightlight data, land cover, population. We're looking at every type of data you could think of to couple with this foundational data set to start to make the insights and discoveries. First, as to where are the medical deserts? Where are those populations of people who are large in number but do not have access to care? Let's start there. That's where you can have the most impact and be most targeted in the medical expeditions that you send to a location. And this is just showing some of the mapping that shows where. In the green, you can see there's lots of coverage. In the white, there's large populations of people without adequate coverage. You can look at it from the politician's lens in donor statistics. You can look at it in quad-tree analytics on the larger, the darker the square, the bigger the groups of people. And you can do this by every single specialty. We've partnered with companies in the tech space, DataRobot, Databricks, Carto, because now we can build this at enterprise grade. And we can use these layers of data to discover where are the optimal locations to put the next healthcare facility. Where is the optimal location to have the next dental clinic or start a neurosurgical service that's going to impact the largest number of people on the ground? So you can begin to change the shape of medical deserts based on the right facilities coming in and the access. You can look at transport, ambulances, tricycle ambulances. And we're actively doing this now at Virtue Foundation. We have tremendous partners, as I said, Carto with the geospatial mapping and geospatial analytics. DataRobot helping us in the machine learning models with our own internal data science team. And Databricks helping us to enrich and create the knowledge graphs around each and every one of these healthcare facilities and healthcare NGOs. It's a tremendous time. We're really excited about what we're building, and I would encourage anybody in this room or watching online, please get in touch with us, link to the QR code, there's my email. We're looking for support from funders, from data science partners, and enterprise-grade partners. Thank you.